my screen, and the clock was just chiming in the background, so I'm sure it's high noon in central Wisconsin. Good morning and good afternoon, everybody. My name is Chris Bruni. I'm the Vice President of Sales for Security Health Plan. We are happy to be here again with you today. I am joined by my illustrious co-host, Mr. Jeff Tucker, who is the Vice President of Business Development and Innovation for the Marshfield Clinic Health System. Our webinar Wednesdays are co-sponsored by Security Health Plan and the Marshfield Clinic Health System, and we are here to bring you as much information as we can about what's going on. We've had a lot of topics on COVID, but that's not the only topics we are certainly able to talk about or willing to talk about. We really want to make these geared towards you. So our audience, please respond to those survey questions and tell us what you want to hear more about, and we will make sure we are gearing our content to meet those needs. As you all know, you will get this presentation delivered to you in email. Ashley Stunkel is our producer of this event, and she will get those out to you shortly after the event ends. But if you need to find it later, you can always find it on our COVID webpage on the Security Health Plan internet site. So without further ado, Jeff, anything you wanted to add before we go ahead and introduce Robin? And we're going to do a little different tack on how we've done it.
No, I think you covered it well, Chris, and I am thoroughly looking forward to this because Robin has actually experienced what we've been talking about. So I think this is, I am personally I'm very, very interested to hear what you have to say, Robin.
Yeah, me too. And I've heard some of it. So we'll without further ado, we'll get started. But before I do, there is the Q&A feature or the chat feature in your in this experience. It's in the upper right-hand corner of your screen. Please use that if you have questions for Robin or any of us. We will do our best to answer them during the presentation. Otherwise, we will make sure we get them answered afterwards and send those out to everybody that participated. So again, without further ado, I'm very pleased to introduce Robin Huff. Robin is one of my employees actually at Security Health Plan. She and I have had the great pleasure of working together for, I don't even know how many years it's been, Robin, but I think I've known you pretty much my entire time at the health plan, which is over 15 years.
Sure.
You didn't always work for me. Robin has had some time in customer service as well, really kind of sharpened her skills there. Then we stole her away from customer service, brought her into the sales realm. She works on the consumer side of our business, so not really with our employers, unless you have a whole bunch of employees that are going to be retiring, or if you're looking for individual coverage because you have employees that are going to be retiring early, or you have people that need to leave employment, or maybe they're part-time. Robin works with you on our individual plans or with our Medicare plans. And Robin is with us today because Robin was one of our very first employees at the health system with a confirmed case of COVID. So Robin is going to talk a little bit about the COVID experience. We're going to do this in kind of a Q&A kind of a fashion. So Jeff and I will be asking Robin questions. We really want to gear it not so much about her experience of getting care and treatment, although we'll spend a little bit of time early on talking about that. But we want to talk about her experience with her employer and maybe some words of advice to you as employers of what you could do to interact with your own employees, or their if they or their family members are having a COVID experience of their own. I do want to preface this all by saying none of us on this webinar today are medical professionals. So if we talk about hunches or intuitions, Robin's got a lot of them related to how this illness progressed within her, or things that you know, there may not be scientific proof of what she's saying. These are hunches that she'll have, and we don't want to discourage those, but we also don't want to say this is scientific evidence. So without further ado on that, then I will ask Robin to just, if you wouldn't mind, Robin, just tell us a little bit about how this particular illness began its onset with you. And again, I know it was back in March, so it was relatively early as we were starting to experience our own shutdowns here in the state. Tell us about your early experiences with it and maybe some of the symptoms that you were experiencing.
Okay. First of all, you know, interestingly, my manager had called me. I was at a seminar on like March 12th up in Rice Lake, and she said, you know, I really would feel better if you would just go home and start working from home for a while, because, you know, she knows I have respiratory sensitivities. And she said, maybe you should just, you know, go. And so I did. The very next day on the 13th, I had a minor foot surgery and didn't think much of it. It went very well. But 2 days later, out of nowhere, like a ton of bricks, all of a sudden I got 102.5 fever. And I didn't really think too much of it. It's unusual for me to get a fever because I could count all the times on one hand that I've had a fever in my adult life. And but it was hard and fast. And like I said, I just had a minor surgery. So I thought, oh, well, maybe it's just a little hangover from it or something. But I got sicker and sicker. And I think the second or third day, I started getting body aches, especially my lower back for me. I don't know why, but I couldn't sit, couldn't stand, couldn't sleep. It was, you know, and I had fevers for, oh gosh, up to 104 until I found out 11 days later what was going on with me. I was pretty sick. And I did have some, and I noticed it within the first week. I did have a loss of taste and smell, which I thought was really weird. And that was before you ever heard anybody talking about it. I did notice it, but it did go away. But it was gone. It was gone for several days. I also had, later on, I had some GI symptoms later on in the whole experience, but to me, the worst of it was the horribly high fever. And I felt like I couldn't wrap my brain around almost anything anybody said to me. It was a really strange experience for me because usually, no matter how I feel, I can take a phone call if somebody calls me, you know, from work or, you know, a customer or whatever, or an agent, and I can, but I felt like I couldn't. I just couldn't do it. It was not fun. Let's put it that way.
Yeah, I can only imagine. So Robin, you did end up spending several days in the hospital?
I was overnight in the hospital. I think it was 10 that I actually ended up in the hospital and found out. I did have like kind of a burning, and that's really important. I did have a little bit of a burning in my upper respiratory, a little bit of a dry cough, but I do battle asthma from time to time, not really bad, but certain triggers. And so I didn't think much of that part of it. To me, it was the fever. Well, when they finally did a CAT scan on me and stuff, they thought it warranted it because I had that little surgery too. They wanted to make sure there wasn't a blood clot or something. And they did find out that I had granular pneumonia, acute bronchitis. Yeah, I was in overnight, and they did, you know, give me medication and stuff and then sent me home. And still at that point, we did not have a diagnosis for this virus. It was after I got home, I'd say about 4 or 5 hours later, I got the phone call.
Right.
Yeah. And it was probably, yeah.
I'm sorry, go ahead.
I was going to probably a good 30 days that I didn't have any fever at all. I mean, after that, probably day 11, it started to dip down under 101 finally. But I would say, and I'm normally a person who runs at like, you know, under 98.6. I'm kind of a cool cucumber. I'm in the 96s or 97s. And it took me a good 30 days to get back to that point.
Wow.
So, yeah.
So after, you know, so you spent a lot of time at home.
I did.
Do you feel that, was your home prepared for this? Were
No.
you able to, you know, it's almost like you were hospitaling at home.
Yeah, it was, once I found out about it, because my household did get sick with it. We have 2 people living here besides me, my husband and a granddaughter. And I already asked my husband, he's fine with me. I don't have to tell you his name, but he's fine with it. He did get it. But then he was the one taking care of me when I was sick. So truthfully, to me, I think he was, like handling my eating utensils and all that kind of stuff. We have a 20-year-old granddaughter who never got it. And here she was in a house with 2 people. But what we did is, and I did share this with you, Chris, is that, years ago, we have a son that had acute myelogenous leukemia. Once we found out what we were dealing with, we knew exactly what to do for infection control in this house. So then I was, once I knew what I was dealing with. So thankfully, we have a 3-level house, and each level has a bathroom and a bedroom. So each one of us was in our own floor, and that's what we did. I communicated with my husband and my granddaughter by FaceTime, and they did with me. My granddaughter, she wrapped herself up, and she would make meals for us and put when we were up to eating a little bit, and put them outside our doors. But she would, and I told her what to do, and she found out herself. She looked on YouTube and did all kinds of stuff. And I myself and my husband, like I said, we've been through this before, so we were having to be real careful. And so we did, cleansing our doorknob handles, keeping, very careful with dishes. My granddaughter wore gloves when she did anything. She wiped everything down before, during, and after, put gloves on while she did it, touched anything, then, sanitized everything afterwards. And all of us, like I said, we stayed in our own bathroom, kept our own bathrooms clean in our own area. And that was very helpful. Okay. And she never got it. She was in the house with 2 of us.
So then shifting a little bit to your experience as an employee, and again, you're an employee of Marshall Clinic Health System, so this will be different and unique for every employer. But talk a little bit about the experience you had with your employer, and I know that you ended up going out on short-term disability and ended up missing quite a bit of work related to the illness.
I did.
So talk a little bit about that experience, if you would, please.
Like I said, I didn't really get what was happening to me at first, so I just kept on calling my manager and saying, listen, I don't know what's with me, but I still have a fever. And she was just wonderful. She said, don't worry about it. Just get better. Just get well. We'll take care of it. And then finally, when I found out what it was, my first thought was everybody I was around. So was hers. And so, of course, we let employee health know. And then, so she had directed me to talk to them and, of course, call HR, because one thing when you're that sick, and, talking to employers, I think the most help you can be to your employee is, in the back of your mind, you're wondering, how long is this going to go on? How am I going to pay my bills? How am I going to get groceries? All kinds of stuff like that. You're quarantined. Our whole house was quarantined. But my manager and human resources, they were just wonderful. I know everybody was going through different schedules for working, and HR had their, down times with working with different employees and stuff, but I think they went over and above, making sure I never had to hang there. I needed to know, what do I do for PTO? What do I do for my paperwork for short-term disability? And my manager Kelly too. They just did everything as fast as possible. I had so much to do because the health department was calling every day, and they were emailing me twice a day for each one of us, myself and my husband. I had to answer those emails, what was going on with us. So it wasn't like I just got to lay here, I felt like an air traffic controller. There was always something to do or somebody to talk to. But my employer, they were great.
When you say the health department, you mean the public health department of the county?
I'm talking about the public health department. Yep.
Okay. Just wanted to clarify that for our audience.
Yeah, they were very nice. They were very nice too. They really were. But it was a lot to have to wrap your mind around, and that's why having the help at the employer level, like I said, the back of your mind is, how long is this going to go on? When am I going to feel like a normal human again? How am I going to pay my bills? They were just right there and just made sure that everything was as smooth as possible. I didn't have to miss any paychecks. I didn't and all the paperwork, it came to me really quickly. It got answered quickly. They told me what to do with my doctor. And actually, even the insurance company that we have for short-term disability was wonderful. They were really nice. Everyone was so helpful.
That's good to hear.
Yeah.
So if you had advice for our employers out there that are listening to this conversation today, and then maybe they have their own employee that's out on disability now, or they've got somebody that they know that is experiencing this illness, what would be your advice to them to interacting with those employees?
Well, I would say, yeah, be as supportive as you can. Help and have ready, answers to those questions with, how do I keep my insurance going? Very thankful to Marshfield Clinic Health Systems for helping us out the way they did with our insurance. Very grateful that they're paid for telehealth visits, which I utilized heavily in that month or so I was off. And that, the making sure that all those things that you have to think about, your insurance and where's my next paycheck coming from, having that paperwork ready, having the help handy. And, on a personal level, if you have an employee you know of that maybe doesn't have a lot of family around, you might want to check on them and make sure they have somebody helping them do, food and medicine runs. Because seriously, if it wouldn't have been for the fact that we had a lot of family, they dropped everything off on the porch, for us. And we couldn't have done it without them. But everybody was wonderful in my whole life. I think I was very blessed that way. So, yeah.
So you mentioned the telehealth visit, Robin. I want to spend just a little time. We'll shift gears a little bit. Had you ever had a telehealth visit before?
No, no, I never. But it was very comforting because the first couple weeks of all that, not knowing what was going on, and actually, I didn't have a chance to talk to my own doctor, and then I did, and he checked in with me, gosh, every other day. It was just really nice. I really did not feel like leaving the house, and plus you had to, mask up, and you had to, and you got to remember I had a bum foot, so I was on crutches, and then I had this going on, so I'm like, oh, please leave me alone. Let me stay here in my bed. I mean, I couldn't sleep all the time. I had things to take care of, but I was just in my little room up here. So I was so grateful for that. And I felt like I was well taken care of all the way around.
That's good to hear.
It's very nice.
Good to hear.
Mm-hmm.
So as looking back on this, if you could do it over again, is there anything that you would have done in preparing your household, your personal affairs, anything related to your employment that you could have been better prepared for? First of all, the illness, and secondly, the time away from work or dealing with being away from work?
I don't know that you can ever really prepare for something this big. This was a very intense experience on every level. But always making sure you have good relationships with everybody, in your workplace. And we're very fortunate in the department I work in, just making sure that you do your due diligence and communicate. It's very important that I think as an employee and employer that, you have open doors of communication. I wished I would have had a little bit more PTO left when that happened, but we had a few things. My husband had a surgery earlier in the year, so I had off, but still, really, HR really helped me work around all of that too. As far as my home, good thing, because, there was a shortage on so much stuff, but I'm a person who has a lot of Clorox wipes on hand and lots of cleaning supplies, so I didn't run out of anything. I'm really thankful because, like I said, we've been through this before as a family, and that infection control is really important. And we really were to the point of when somebody brought us groceries, we wiped down all the packages before we put them away. I mean, maybe that's overkill, but we did that. And like I said, our granddaughter never got sick. I mean, in a house with two other people, that's phenomenal. So,
This is really
Yeah.
this is really helpful because this is really like grassroots, down to earth, basic things that any person can be doing, and so this is really good advice coming from somebody that's been through it for any of our audience to just hear about how they could prepare or plan for this. And this illness will likely be around for a while. Again, we're not medical professionals, we're not scientists, but we're parroting what we're hearing out there, and that it looks like it's going to be around for a while. So the chances of us going away from this anytime in the next couple of weeks is probably slim, and a few months might be slim, even might be slim as well. Jeff, any questions from your end? I know that I've kind of dominated the questioning so far.
And every time I had one, you asked it. You did a great job. Yeah. Were there any other, you've mentioned public health was in contact with you,
Every day.
your employer every day. And did they have resources for you? Did they point you in a direction for looking things up or other options, et cetera?
Yeah, the public health nurse, she called probably for the first couple of weeks. And there was, one time where she was really super helpful. I told her something that my husband was experiencing. His experience was a little bit different than mine. He actually got sicker in a different area, but she told me exactly what he needed. I knew what to do when I actually had to call an ambulance one day. And so that was very helpful. She told me what to ask about, and I don't want to say it because it's different for everybody, but that was very helpful. And yeah, there were resources all the time. I mean, we get emails every day at Marshfield Clinic about things. And so, but I tell you, living it is a whole, and everybody's experience is going to be different. It really is. Some people are asymptomatic, and some people, feel like they had a little cold. It was a little bit rougher for me, but yeah, at least I felt like I had what I needed.
So it sounds, I've read the articles of people that have contracted it, and I've always wondered, is this the extreme end of it? It sounds like it was as miserable as the articles that I've read. Would you characterize this as the worst flu you've ever had? Was it that bad?
I would say that it's probably, I've been through a few things in my life, more, happened, different surgical procedures. And like I mentioned, I had, I do battle respiratory sensitivities. And from time to time, that's it. But yeah, I would say this was the worst, especially in, the intensity of it. I mean, to have that high of a fever as an adult for 11 days I can't even explain it. I felt like I was suspended somewhere. It was not fun. And I just didn't feel normal for probably about 6 weeks, I'd say. I feel very blessed because there are a lot of people who have lingering things. I don't feel like I have anything lingering. I don't. And my husband either. We're doing well, but it was something I would never wish on anyone. Never. I wouldn't want to see anybody go through it. Let's put it that way.
So when were you able to return to work?
I think it was towards the end of April. Maybe it started on the 15th. I think it was April 27th, maybe. I think it was something like that was my first day of work back, something
so again,
like that.
When you say the 15th, you mean the 15th of March. So you actually were out for a little over 5 weeks, if I'm going off my memory here.
Right. Something like that. Yep. It was 5-6 weeks. And I was, thank God that we were working from home anyway. I could not, if I was traveling like I used to do and stuff, I don't think I could have done that. But the fact that I'm still sitting in my little room up here, my little loft, I was able to at least, get back in the saddle and, obviously my mouth never gets a rest no matter what. That's my life of my mouth. And so I had to do that even while I was sick. It was always something I had to take care of. But, because of that and having the tools I need at home for quite a while, it worked out well. I was able to do my job including, sales and phone calls. And so, yeah, I mean, and I'd been used to that for quite a while. So that wasn't too difficult at all.
Right. And for our audience, I'll just elaborate on that a little bit. So our sales department at the health plan, most of our sales staff and account management staff do work from home, and that has been the case for a number of years. So we have our staff essentially living in their territories, and then they can, kind of jump off from there and go where they need to go on a regular basis. They've all been grounded basically since March 13th.
Yeah.
So we've been keeping everybody close to home and dealing with everything over the phone, which has certainly presented challenges for us because, frankly, we love interacting with you face to face. We would prefer that over any other means, and I know
That's
Robin
true.
feels that way as well. Yeah.
I do. Yeah.
So it was 5 to 6 weeks before you started to feel like you're again?
Yeah. And I would say probably, feeling a little extra tired for a while after that big thing to go through. I would say if you'd say a full getting back to feeling normal, probably 2 months, probably a good 2 months. I feel pretty normal now. But yeah, I would say it was a good 2 months. So like I said, some people do seem to have residual. The only thing that I had residual at all was I think that I was smelling things that weren't there for a few weeks after I felt better already. Yeah, I did. I felt like I was smelling exhaust, and I live on a lot of acreage where I live, and believe me, there's no exhaust out here. So I knew it wasn't real, but I would have fleeting things like that, but that went away too. So that was the only thing that was kind of strange. But other than that, it was just really needing a lot of, needing to kind of cool it. And so it's good that I was working from home. That worked out. That worked well.
So I didn't everything, and I'm going to go by memory, which is always dangerous with me, but it sounds like the things that helped you out were educational materials on this topic, on COVID, that HR and your employer stepped in with short-term disability, questions on your health insurance. So an employer being responsive on the health insurance and short-term disability insurance front. Public health, did they reached out to you, right?
And then got called.
Okay.
Yep.
Okay.
They called us daily for a couple of weeks. Yeah.
All right. And then access to virtual care. It sounded like that was a definite positive in your life.
Absolutely.
Did I miss anything among the resources that made it easier as an employee going through such a difficult situation?
I don't think so. Communication's a big thing. I'm very grateful for, the management staff we have, Kelly and Chris and everybody is just in the HR. Everybody was just, everyone was real easy to communicate with and just right there for me. So, and it's always been like that. So made it easier.
So one of our participants just sent in a question. Did you ever get a sore throat as part of this?
No, I did not. That was me. Mm-mm.
Okay.
Well, Robin, we are pretty much
Yeah,
we are pretty much up against the clock here. We want to be
Okay.
cognizant of everybody's time and commitment to joining us today. Any last thoughts you want to leave with our group?
Well, I'll tell you, like I shared with you the other day, I think there's something this serious. It really makes you think about what's important. And I try not to get choked up, but you really realize what's important. And loving people and them loving you, your faith, knowing that I was loved by the Lord Jesus and the people around me, and being able to love them back. That is the most important thing in this life. And I feel so blessed for every single person that was in my life. And I feel every human being is precious and every life is precious, and we need to love each other. That's all I got to say. And be kind to one another.
Well, those are great words to live by, whether we're in a pandemic or not. Thank you very much, Robin, for joining us today and sharing your story.
You are
Again,
very
this is a
welcome.
webinar. This is Webinar Wednesday. This will be sent out to you via email, and it is on our webpage. Thank you, everybody, for joining us, and a special thank you to Robin. And so we are very blessed to have you on our team as well.
Thank you.
And so glad that you have made such a miraculous recovery so frankly quite quickly.
Yeah,
for how some
absolutely.
of these people around the country and around the world are fighting this dreadful illness. So, Jeff,
Absolutely.
I guess
No,
we can sign off, hey buddy?
Yeah, we can. All I can say to what Robin closed with was amen. That may be the best closing for any of these webinar Wednesdays. So thanks so much for sharing what you went through with us.
I'm very welcome, and I'd be happy to talk to anybody anytime.
All right. Thanks, everybody.
All right.
Be well.
Bye.
Thank you. You too.